Good morning, good afternoon, or good evening, whatever the case may be where you are. My name is Win Morgan, and I'm going to be working with you today on how to conduct a capacity assessment for facilities for cervical cancer prevention and control costing. In this session, we're going to talk about 5 things. First, what it means or what it is to conduct a facility capacity assessment. Second, why it is important. Third, how to do it. The fourth will be try it, where I will demonstrate how to do it since you're not with me today. And fifth, how to use what you have learned for a costing of cervical cancer program scale up. Let's get started. Let's talk about what it is. When we talk about capacity, we're talking about the potential maximum number of procedures that a typical facility can complete in 1 year. We assume that the required supplies and equipment will be provided, and we'll assume that required staff time is available. You'll find out later that we do make an assessment of the supplies, personnel, and equipment that will be needed. But for the capacity, right now, we make those assumptions. So what we're talking about is how many facilities are going to be providing a particular service and how many you're going to be able to do in a year. Why is it important for us to do this? It's because we're providing a reality check on the settings of service goals in your C4P or the goals that you're going to have for screening and for treatment. Secondly, it will form the basis for equipment quantity requirements that we will have and cost estimates. Later on, it will also form a basis for knowing how much staff time we're going to need and approximately how many supplies and materials we're going to need. Let's talk about how to do it, and then I'll give you a demonstration about how it's done. The first thing is that you want to use the C4P tool. Built within the C4P tool is a facilities and annual facility capacity estimator, and also a service unit capacity and staffing requirements estimator. Both of these are going to be very helpful for you and for the people with whom you're working to understand what you have available or what you plan to have available and what the incremental cost of it is going to be in terms of resources. Within the C4P, there is a tab or a sheet called the Facilities Service Capacity tab. You can reach it in many different ways using the several forms of navigation in the C4P. I won't go over that now. I'm going to assume you've already learned that. When you get to the Facilities Service Capacity tab, you'll be presented with a sheet like this at the very top, which asks you, what types of facilities are you going to be estimating the capacity for? And how many facilities will be active in each year of the scale-up? The good news is that you're only going to have to write down or input the types of facilities once. After you've done that, you're going to see that the tool will self-input the same facility types throughout the rest of the tool. For example, here I've typed in hospital, health clinic, and health post as the 3 types of facilities. Yours may differ. The second thing I need to do at this top level, and look, we're looking at number of facilities providing any procedure requiring a basic set of gynecological equipment. It's right at the top of that sheet. And we'll have to say the number of facilities that we think we are going to have available for that year. This first entry is going to be very important because as we look at other procedures that are going to be provided and how many will be provided, we need to know how many facilities have a basic set of gynecological equipment. When we look at the other procedures, we will also be able to add in other equipment specific to those procedures. But right here, we are just saying for any facility that is going to be active in any procedure, how many are there going to be? Because they're going to need a basic set of gynecological equipment. In another part of the C4P, which you don't have to worry about right now, there will be a set of equipment for that basic gynecological procedure set. So we will have already said if you're going to have a set of equipment for basic gynecological procedures, you're going to need an examination table, a stool and a chair, instrument tray and trolley, speculums, and forceps, and watches, clocks, bright white lights, and then, I didn't forget, the biohazard waste container. We will be building this list and customizing it in another session. But we wanted you to know that when we say the number of facilities that are needed, that will be used to determine the number of equipment sets that are going to be needed in the calculations. After we have done the number of facilities that will need a basic set of equipment, we are going to move on to specific types of activities or procedures. Here is an example of thermal ablation service. When you get to a point here in the file, you will see that there is already a number here that is based on the types of procedures you want to have to handle a particular situation, in this case, small precancerous lesions. And it also considers what you have put in as your screening goal to help determine how many people are probably going to need thermal ablation. And it also takes into account something you've also put somewhere else in the C4P, which is the proportion of small cervical precancer lesions that you want to treat with thermal ablation. Because there is cryotherapy or thermal ablation, you will be able to choose what proportion will be served by thermal ablation and what proportion will be served by cryotherapy. And that will be able to be changed each year. So that is where the numbers are coming from. Now, you look here and you'll see number of facilities again. So the first thing we want to do before going to the annual facility capacity is to estimate the number of facilities of each type that will be active and providing that particular service. In this case, the thermal ablation service. Note that that can change over each year. So if you're scaling up and increasing the number of facilities offering the procedure, you will be able to do that by just saying 2, 3, 4, 5, 6, whatever. When you go to a cell where you've put a number that is larger than the number of facilities of that type that have basic equipment, you will get a pink cell. The cell will turn pink because what it's saying to you there is that you have chosen to have 6 facilities of the hospital type, in this case, providing thermal ablation service. But you, at the very beginning, had said that only 5 hospitals will have the basic equipment necessary to perform any type of procedure. So this will just remind you to go back and increase the number of facilities of the hospital type that have a basic set of equipment. Also, when you're doing this, you will see that if you try to have more facilities in one year and less in a following year, that the cell will turn red. It will turn red to tell you that you cannot move your equipment from one facility type to another. Well, basically, it's helping you to not end up double counting and not end up making the mistake of saying, I am going to equip this number of, for example, hospitals or health clinics, and then they are not going to be equipped in a following year. That's not allowed in the C4P. Let's talk about how to assess the annual facility capacity by type. So what is going to happen here is that we are going to estimate the annual facility capacity for each type of facility. We're going to then multiply it by the number of facilities that are going to be available in that year. And the tool is going to compare that number here with the number that we've said we're going to need to reach our goals. If that's too few, then a little red message will come up that says not enough capacity. The question you're probably asking now, most people do, is how do I estimate the annual facility capacity of, say, a hospital or a health clinic type or a health post type? Well, the C4P can help you there. You will want to go to the Service Unit Capacity Estimator tab, which is also in the C4P. In that tab, you will be able to estimate the capacity by year by putting in a few other estimates. The first one that you will put in is to estimate the total number of minutes required to perform one of the services in the service unit. For example, if we think that it's going to take 20 minutes overall for the service providers to provide someone with a thermal ablation, just for example, then we would put in 20 minutes. If we think it's going to take a little bit longer, like 30 minutes, we'd put 30 minutes in there. We will then look at the assumption of how many hours the service unit is going to be open on a service day. Often, a facility will be open, but then the service being provided is not available every day of the month. So, also you can say it's not available all day. So some people may say, Our rural health facilities, for example, will only be offering thermal ablation for half a day when the facility is open, say 4 hours. So we'll put 4 hours in there. We can also, if we want to, assume how many minutes per service hour are used. And we usually will say 60 minutes, but sometimes we may say 50 minutes. We may even say fewer, depending upon what the average amount of time is that a service worker actually works within a service hour. Next, we will assume the number of service days that the unit is open per month. For example, if I'm going to be offering thermal ablation, am I going to be offering it every day of the month? Am I going to be offering it 1 day per week? Am I going to be offering it more than 1 day per week? In this case, you have a clinic that's going to be offering it just 1 day per month, rather 1 day per week. And so you have 4 service days per month per unit. With these numbers, the C4P tool will estimate your annual service capacity, and it will be shown right here. You will need to do this estimation for every type of procedure that will be provided. So this is not going to be linked automatically to that annual service capacity that we saw before. Every time you want to do an estimate, you'll go to this Service Unit Capacity Estimator tab and do a new estimate for that procedure, for that facility type. Let's try it. All right, let's try it using the C4P. I'm at the C4P tool. I have opened it in Excel, as you can see, and I'm on the cover. Remember, if you want to do this in Spanish, you just go and click here to Español, and you will have everything in Spanish throughout the C4P. I'm going to continue in English because that is my best language. On the cover, I'm going here to this infrastructure button, and I'm going to click on the infrastructure button. That takes me to the section on infrastructure. You'll see here that there is the facilities available and annual facility capacity, which I'm going to be using. I'll also be using the service unit capacity and staffing requirements estimator during this session. So I'm just going to click there on that. And you'll see here that as I go to the top, that I have the number of facilities providing any procedure requiring a basic set of gynecological equipment. So I've already put in the numbers 2, 3, 4, 4, and 5 here. For the clinics, just let me put in 200 and then 300. And then I'm going to stay at 300 for the rest of the time here. So I can copy and paste. And remember, I told you if there are less facilities than the previous year, you'll get a red cell error. But when I put in 300, we're fine. I'm now going to put in 1,229 health posts, and I'm going to keep that the same here. Going throughout here. If I were doing a scale up where I start small and work my way up, then I would probably have fewer facilities here and then I would work up to more facilities here. But for the purposes of our exercise here, I'm just keeping it the same. For the number of procedures, providing any procedure requiring a basic set of gynecological equipment. You will notice that the annual facility capacity column is not in use in this first set of inputs. And that's because we are going to be doing an annual facility capacity estimate on each of the procedures that we're going to be working on. So now that we've put these in here, those names are going to be repeated throughout this sheet, except when we get to laboratories, in which case we will put in the names of the types of laboratories. And that's only going to be for the HPV DNA sample laboratory processing. Now, you can see here that I've put in an estimated number of facilities that will be providing HPV DNA screening, provider collection of samples. As you can see, I've put in the number 5 here, but as you may remember, I've said only 2 hospitals are going to have a basic set of gynecological equipment. So what I need to do is either reduce this number here to 2 or increase this number to 5. So let's just say I increase that number to 5 throughout. Now I can say that in the first year, 2 of those hospitals will be providing HPV DNA primary screening, and then 5 will be doing it in the next 4 years. Now I know I have 200 health clinics that I can work with. I'm going to start with 20 and then go up to 30. And then 50, and then 100 or 200. I'll go to 100 here. And then I'll go all the way up to 200 in year 5. So that's a true scale up. You'll see here that I have a facility type and I've put in some information here. But because I have no facility type really listed, I'm going to get error messages, which is just reminding me here that I just have to delete all this information. So now you're going to see that we have annual facility capacity of 2,000 estimated for each one of these. Well, really, that's not correct. What we need to do is estimate the service unit capacity using the service capacity and staffing requirements estimator. So you'll see that when I was here on each one of these, I clicked on this and it took me to the service unit capacity staffing requirements estimator. In here, I've said the amount of time that service providers will be required to spend on the average HPV DNA collection process, then sending it into the lab, then getting the lab results, and then reporting them to the patient is about 20 minutes. So I've said that is about 20 minutes. Now, I also know that the outpatient department of these hospitals are going to be available for 8 hours per day. Even though the hospital may be open 24 hours a day, they're providing this service just 8 hours per service day. But I also know that the outpatient department that provides this is going to be offering this service 5 days per month or 5 days per week. That's 5 days per week, which would be 20 service days per month for a unit. I've estimated that there's 60 minutes in a service hour. That's pretty standard. So now you can see that I've done that I'm going to get a result here of 5,760 services per year can be accomplished by that facility type using these estimates. So I go back here to the service facilities service providers and look again, remind myself 5760, and then I type in 5760. Based on that, then these are going to change. The total capacity available is going to change. Now I go back and do the same thing for the health clinic, the average health clinic. I still think it will take about 20 minutes per service. With the average health clinic, then I also think that they're going to be available for 8 hours when they open to provide this service. But I also know that most clinics in this area only provide this type of service 1 day a week. So that means that they're providing it 4 service days per month. That's going to reduce the estimated capacity to 1152. So I go back here and I say health clinics 1152. Now a health post, when I go to it, health posts sometimes are only open 4 hours per day. They're not open in the afternoons. And so even though they're also providing 4 service days per month, then they're down to 576 services per year. So I go here and I say 576. Based on that, you will see that I am going to get an estimated total capacity of 51,840 procedures that can be done with this number of facilities at this estimated facility capacity. You will also see here that I will get a message that says that's not enough capacity for the amount that you said that you want to try to achieve. Where is this coming from? The amount that I want to achieve? Well, that's coming back from a number of places. First of all, the number of target populations who you have that you're trying to reach. Secondly, the assumed epidemiology, or what I say is the cervical health conditions that you expect to find within your target population. So here we're expecting that for anyone we screen, 4.8% of those people are going to require small cancerous lesions visible, for example. And when we get into the other situations of treatment, that's going to limit our need. And also here we have screening goals. So here I have set 15% screening goals, here 20, 25, 30, and 35. That's for the percentage of eligible population at the time. You will notice that that's setting an 867,934 people will need to be screened then. And of that, I have said on my primary screening methods here that only 10% will be screened using HPV primary screening. Note that I can change this, so I can rearrange that. Anyway, we'll come back to that. But again, that is what is deciding what this number is for the procedure and whether or not you have enough capacity. So I'm going to need to do this for each of the different types of screening and treatment methods that I am going to do. You'll notice that here with HPV DNA primary screening, there's two ways of doing it. One is to have the provider collect it, and the second is to have the patient collect it themselves. Now we know if the patient collects it themselves, there will be less time required by the service provider. And so we will probably be able to say that there is going to be more annual facility capacity here. We also have to remember that if we want to use this method of self-collection by patients, then we are going to have to assign that in the primary screening methods here. So if I say 10% here, right? Yeah. So I'm going to say 10%. And then here, I'm just going to say this now needs to be 80%. No, I'm just balancing these out, as you can see, so that everything balances out to 100%. There you go. So now you see I've changed the primary screening method mix. So now when I go back to facility service provider capacity, then you'll see that I also am going to have 86,000 here that will need to get screening, and it's going to go up. It's going to change as the target population size changes, right? So I'm going to have to do, again, an estimate of the annual facility capacities for each of these. One special area that you're going to need to understand is that although this is the collection of HPV DNA, then there also needs to be processing of the HPV DNA tests. So here, let's say I just say, all right, I'm just going to say for the annual facility capacity, I'm going to put this here, right? So here I am going to estimate the capacity for patient self-collection of samples. So again, I go to the facilities service capacity, then go to the service unit capacity estimator, and I can estimate that it will take about 10 minutes per service for a hospital to collect and then send and then report on these. 8 hours of service per day and 20 service days per month there. And you'll see that I've got 11,520. I go back here and say 11,520. And then I go back for the health clinic. And I look at it and I say, okay, 10 minutes. I know that they're going to be doing 4 hours of service per day. And they're going to be doing 4 service days per month. So that's going to be 1152. Oh, so I realize, oh, okay, no, actually I said they're going to be doing 8 hours per day in a clinic. And so that's 2304. So I can say 2304. And the same thing for the health post. I can go back here and say that they're going to be doing it, say, 4 hours per day. And that's going to be 1152. Now I have the annual facility capacities estimated. And I also have the number of facilities estimated here. And you can see that I'm okay here, but not okay up here. But then I also want to go down here to the laboratory network facilities. And let's say that I only have one laboratory at the national level. Now, on this particular annual facility capacity, you are going to need to talk with the laboratory personnel and ask them to estimate how many HPV DNA samples they can process in a year. Some might say we can do 20,000. Some may say we can do 50,000. Some may say we can do 100,000. What this is, again, is a good reality check. So here you say if they can do 100,000, right? You're going to see that there's going to be not enough capacity for all of those HPV DNA samples that we've collected. So we might have to say, oh, we're going to have maybe a smaller regional laboratory then. And let's say we have 3 of those. And we still don't have enough capacity. So let's say we have a district lab with 50,000 as well. And let's say we're going to have 20 of those. Let's go to 20 here. I had said 220. You can see 20 now seem to be okay. Yeah. So as you can see, this is a way to have a conversation with the Ministry of Health people and with the people who are making sure that we have enough machines, enough facilities to compare the expectations relative to our goals that we've set and our strategies, to compare it with the amount of resources we think we're going to be able to provide. Okay. So here you see we've got the VIA done. I don't have cytology in here, but if you could, same with colposcopy. Here you have a thermal ablation service, and you see that if we just do 1,000 of those per hospital, and we only have this number of hospitals, we're not going to have enough capacity. So again, going through all of these different, up to 9 different types of procedures, figure out the capacity and the number of facilities per year is going to really help you to make a realistic estimate, not only for the planning, but also for cost. So, how will we be able to use what we've learned here? With the C4P, we have designed the tool to start an interactive discussion with government focal points about what they're planning for and what resources they can apply to that or will need to apply to that. Because it's an interactive tool and it gives you immediate results, you can show how changes in infrastructure capacity will affect screening and treatment goals, and also how screening and treatment goal setting will affect the need for infrastructure capacity. As you're discussing the costs associated with increasing your infrastructure capacity, you will also be able to talk about equipment maintenance, staff assignments that are going to be needed, what training requirements there will be for trained staff, and supply chain impact. Let me give you just one example of that. Here we have already determined the annual facility capacity for hospitals, health clinics, and health posts to provide HPV DNA primary screening where the provider collects the samples. And here you can see the number of facilities, right? So we've discussed how that works. Now, the other thing that we can look at here is the service unit capacity and staffing estimator. So you can see here that I had put 1,152 for a health post. Now let's assume here as we go down that the number of hours that a service provider works in a working day is 8, and they work 20 days a month at this type of facility, and a full-time equivalency hour is 60 minutes per hour. That means that one of these full-time equivalencies will require 9,600 minutes per month of work. Based on what we've said of the number of services we're going to be providing per month here, we're seeing that we need 1/10 of a full-time equivalency to run that service unit at full capacity. However, we also know that trained staff, once you've trained them, may be trained in very many different procedures, and they may only be able to have, let's say, 25% of their time that can be allocated to providing HPV DNA sample collection. Well, let's say that it's 25%. If it's 25%, then it's saying that you are going to need at least one trained staff person per service unit to be able to run at maximum capacity. But what if we change that and we say that, as we said, it takes 20 minutes per service for a service, and we assume that we're working 8 hours per service day, and we're working a total of 20 service days per month per unit. Then you see that it's going to change to 480 services per month. And here you're going to see that if we assume the same things, 28 and 60, that you're going to need one full-time equivalency here to run the service unit at full capacity. But because you have 25%, so each of the trained staff is only available for 25% of their days or minutes to provide this service. It's saying you are going to need 4 trained staff to be able to work at full capacity. Basically, the calculations tell you that if you haven't trained 4 people, but you've only trained one, then you're only going to be able to provide a quarter or 25% of this maximum number of services per year, because that one person will have only 25% of their time available to provide the services. This is going to lead into a number of discussions. And let me show you some of the things that you'll be able to look at. One is going to be procedures versus capacity. A second thing, which will be very interesting, is that the number of sets that are going to be needed for purchase are going to be already set, and you will be able to see what you're going to need to have in terms of your equipment and your additional hours per personnel type each year. You will also be able to know how much you're going to need to invest in equipment based on the calculations that you have made about the capacity you're trying to achieve. So you'll even know what the cost will be of the additional human resources as you move through. I think that's pretty neat. And you will also know what amount of trainings you're going to have in another part of this C4P. This is an example of how the C4P is an interactive tool that is designed to be used with your government focal point persons to make a reasonable, rational, well-considered plan for scaling up with a reasonable and rational estimate of what it will cost. Thanks for listening.